The reason we're hosting the Digital Roundtable event today is that society is changing off the back of technology, and digital drives collaboration. You have to work really effectively across multiple stakeholders. So what I'm hoping to learn today is what is the shared perspective across the different people we've got involved in the discussions, but more importantly, what are the things that people see differently so we can learn from that, so we can put better solutions in place.
Why is digital important subject to be debating today? I think there's lots we could do with digital technology. There's lots of ways to misuse it and try to apply it to a situation that doesn't necessarily need it. What we need to do is debate what the system needs to transform.
Looking holistically at the problem, the focus has to be around better outcomes at lower cost with a better patient experience. And that frames what we try to do as an academic department. One of the key strands of work we've been pursuing is a data-driven health system. We use the data produced through the delivery of care, analyse it, generate new insights, and transform that into actionable changes to the healthcare system itself.
We typically see between 5 to 7% of the population going to multiple health services, using multiple council services. The fragmentation of our system is driving poor outcomes and lifestyles for those individuals.
Actually focusing on that 5 to 7% will require the most complex interventions. And I think there's an interesting challenge for us about whether that's the right place for digital, or whether the right place for digital is solving other problems and freeing up the resources for people to help support those 5 to 7%.
The key problem my business is trying to solve at the moment is how do we keep people out of hospital? And we're doing that by focusing on the ageing society. Falls is something I'm very passionate about after caring for a granddad who had a fall, and that fall meant his life deteriorated. And we just want to be the best in the world at preventing falls.
How much would you say the healthcare problems are similar or different to the problems that people have used technology to solve across multiple industries?
I think healthcare is pretty similar in many respects to many other industries. A lot of what the new digital organisations that we know and love, like Netflix and Amazon, they really specialise in understanding you as a customer, capturing data on an increasing basis to make more informed decisions about the services they offer. So I think there's a lot to learn from cross industries. For technology companies, they fundamentally, I don't think, really understand the detailed problem that's trying to be solved. And I think it's getting access to the right clinicians that are extremely busy and then being able to articulate an appropriate solution to those problems.
But also have it be co-designed and developed. Yeah.
Absolutely.
And we're seeing some really, really good, good examples of how that's been done, and adoption is so much better.
Absolutely.
As a result, because what you see then is an intuitive product.
We have to be careful assuming that healthcare is just like any other industry, because I don't think it is. I think you have to recognise that healthcare has some unique challenges about it, and it's often built around personal relationships, the delivery of good care. It's an emotionally sensitive subject sometimes, so I think you can't assume it's just a transactional process.
I completely agree with you. One of the things that frustrates me are the technology approach that treats patients as consumers. What you're actually talking about is citizens who are engaging in a service that's being delivered where, for that service to be successful, it needs to actually serve the purposes of the system and it needs to serve the purposes of the individual. And I don't think there are many examples of technologies that are doing that. They're a technology that's sold to an individual who chooses to buy it, not sitting in the ecosystem.
We've often thought in health that people's views and values and opinions is soft data. I think increasingly so we have to realise that this is valuable data and we need to change models of care based around that.
I think there is something that's slightly different though about healthcare, and that's obviously the sensitivity of a lot of the data.
Some people say that the kind of data within the NHS is the prized data set in the world. I think we've got to be sensitive as a system when we're talking about people's personal data. NHSX recently did a deal with Amazon where they put the NHS choices data through Alexa. You think, great thing. What could go wrong? If a daughter talks to Amazon about contraception, is the dad going to find out the next day because he gets an advert? I think We need to tread carefully. It's very sensitive.
Digital trust absolutely is going to be the number one thing that I think will help us drive the acceleration of transformation within healthcare.
I do think the public are becoming a lot more savvy. I also think the consumers' demand will take us to a point in which they will want to move away from what I describe as a paternal healthcare system to something that they want to take more of a leading role in, and you need data to do that.
What are some of the problems thinking about how you design a great product for people and you're sure that that works tomorrow and in 6 months' time and in 6 years' time?
What we miss sometimes in digital interventions, digital health, is actually the evidence base behind them. We don't do enough to help industry who do innovate here understand what's required from the health system to drive these things into adoption at scale. And I think it's around evidence. And if I could do one thing to change this, it would be to recognise that digital technology moves very quickly, but the pace of collection of evidence moves very slowly in our model that we have. And I think that's a major barrier to digital transformation.
I think sometimes the National Health Service and the public sector get too hung up on the type of evidence. We get asked for randomised controlled trials as evidence, and I'm like, how long is that going to take? It's going to take me years. I think we need a balance. Let's be reasonable when we think about evidence.
There is an issue the other way, which is, let's say there's 250,000 healthcare apps available on the App Store. 33 of those apps make up 50% of all downloads. We also have to help the people who are essentially prescribing those interventions to understand what has value and what is snake oil.
So we need digital evidence for digital solutions in a digital world. Do people have a view about whether we have the right capabilities at the highest level in organisations to resolve some of our digital challenges?
I don't think we're there. I think some of the appointments that are made are somewhat tokenistic at times. We lack sufficient capability to really be able to kind of understand exactly what good looks like, and more importantly, how much good costs. And I think we're way below what we need to be in terms of overall allocation towards digital. I think it's really important to have CCIOs on the board, and what I mean by that is clever informaticians that understand exactly what the true value of data and technology is. You need industry bodies that are conversant with, again, what good looks like, and they have experience of deployments. And I think you need academics or third sector people that, again, have had digital experience so they can understand exactly more about, well, actually, that is what good looks like, and that's how much it's going to cost, and this is the kind of capability that we need in play.
If you look at the sort of skills that are in most demand in the private sector, in the digital community, data scientists, analysts, AI, we do need that range of capabilities. You might have a chief information officer, but you haven't necessarily got a chief data analyst or a chief data officer.
Digital should not be different to any other decision that you make in your business. You're making decisions about long-term investment versus short-term investment. And like in any other business, you need to prioritise what you need to do, and digital is no different. But it starts with that informed buyer on the board, setting the direction to be able to make an informed choice about how you spend that money over what time period.
If we carry on just talking about trust boards, we'll never reach the population. So we need to decide how we do digital leadership in primary and community and in public sector settings.
I'd just like everybody to just summarise maybe a couple of points that they've picked up from this, things we need to do differently so we can leverage the benefits of technology into healthcare delivery.
The key thing is how we do the scale up of digital interventions, how we stop doing small scale pilots, but actually working out how to spread and adopt at scale.
I totally echo that. I think that how we work at scale and some of the challenges is really difficult when decision making is so devolved into individual organisations across the whole city region.
We've got to understand that there's a paternalistic nature of the NHS and start to change that first, but not remove, when we use digital, the personal touch, which adds kindness, but it also adds the touch that makes you feel that you want to comply with medication or advice.
The opportunity for Manchester, in my mind, is primary, secondary and social care infrastructure, including data, all together under one roof. That allows us to use that data to get pointers to where the true unmet needs are, and then have the ecosystem in place to help us really dig into solving the right problem with the right set of actors. We've also got the infrastructure here to generate the evidence and to understand the way we need to change the system to support scaling based on that evidence. That's the opportunity Manchester has that not everywhere around the world does have.
I think we need a kind of real collaborative culture between the private sector and the public sector and academia. That genuine triple helix. The NHS sees industry as bad, and I feel it every day. It's not until sometimes I talk to NHS colleagues about my previous career that I've worked longer in kind of non-profits than tech that the kind of barriers come down. They kind of go, oh, okay, we can work together. It shouldn't be like that. I'd like to see those collaborations go further where the private sector and the public sector health systems actually generate value together and share the rewards.
For me, it's all about getting the basics right, because I look across the health estate and there are so many inequalities. I think it's absolutely imperative when we start to talk about digital maturity, we start to have a really grown-up conversation about how much investment is needed year on year to actually cover that off and get the infrastructure right. There's not much point in focusing on the PRs or the digital innovation that coalesces around ecosystems unless you've got what you need in place to be able to function, then none of that's going to happen.
So I've got 4 points. First one is focus on the problem, not the technology. Second one is the solution to that problem involves people, process, culture, supported by technology. The third is, I think we've got all the ingredients for success. We need to bring together industry, patients and citizens, technology partners, healthcare professionals in a room to be able to co-collaborate new services and reimagine those services. And the fourth point is the way that digital moves and the speed of acceleration and innovation is on an exponential curve. We need to think differently about how we do our traditional processes and embrace that innovation time.
I'd like to thank everybody for their contributions to this discussion, which I think has been very stimulating. Clearly, the two of the things that have come out for me is really this requirement to really focus on the experience of the digital solutions, and secondly, the need to collaborate for that co-creation approach. And I think collaboration across the kind of perspectives we've got in the room is absolutely essential.